The Toronto Video Atlas of Surgery is an open access resource, and it's intended to help surgeons teach surgeons. By combining high-definition surgical videos and patient-specific three-dimensional computer animations, the Atlas demonstrates surgical procedures in a way that tells a story that surgeons can then use to convey very specific messages. Surgery is a very visual discipline, and while it's important to show what you can see in the surgical field, often what is more valuable is revealing the structures that are hidden and only visible to experienced eyes.
I'm not an artist and I don't pretend to be one, but a lot of the ways I would teach in the operating room would be to draw things out for my trainees. One of the specific things that I always have trouble teaching residents about is a very basic skill at a C-section. And no matter how many times I've tried to draw it out and explain it, once I was able to work with the team at TVASurg and they were able to animate that for me, it really delineated exactly the way I want you to do it in that video. One of the hardest surgeries to kind of wrap your brain around is a vaginal hysterectomy. Everyone was so excited about the vaginal hysterectomy video because that allows you to get that exposure of seeing a procedure a certain number of times before you're actually the one in the OR doing it, and you can pause and rewind and reflect on various steps as you go. And I think that's one of the ways where the videos are really helpful.
When I give talks, I think it's either going to be talks to explain surgical technique, mainly laparoscopic, like explaining someone on a slide that says, you put a chest tube through the porta, or to show a video of a 3D demonstration of how you do that. Well, it's night and day, right? People will capture an image much better than a text. And it's the same, for a cancer talk, when you explain how a cholangiocarcinoma grows, where it grows. It's much better to show a video that is a 3D reconstruction of what we're doing than actually explain on a slide where the tumor is exactly. So in terms of colleagues, I think it's a little bit the same thing. It's trying to explain, how we do this, how we do that. And I definitely shared many times links to the TVASurg to show them exactly, how we did this. And a clear example was the last Alps video. We're a group that we've done very few, and these are groups that are the leads in Alps, and I have done 50, but they've never seen a better explanation of how an Alp is done that after this video, right? So people are really appreciative of what TVASurg is doing.
Another reason we created the Atlas is to inspire our colleagues to approach difficult cases using different techniques and methods. We strongly believe in keeping knowledge open and accessible, which is why the Atlas is, by design, free for anyone around the world.
When teaching our fellows, things like how to parachute an arterial anastomosis, how to set up a bile duct anastomosis, what is the W maneuver that we talk about. These little tips and tricks are really helpful and very well displayed in the Toronto Video Atlas of Surgery. The Atlas reminds me that it can be done in bigger and better ways around the world, doing these operations that we sort of dream of here.
And I plan for cases that are complex but rare, such as liver resections with cable resections. I use the Video Atlas for planning and also to share with the trainees my plan for that specific case. I really do believe that the Toronto Video Atlas is instrumental in helping me provide better care for my patients.
The Toronto Video Atlas helped me a lot as a fellow, but even more as a consultant. I found that its 3D animation one of the best way to explain surgery to fellows, especially the quality of the video and the way how nicely everything is described, even the most complex procedure. I think it one of the best way to help a trainee to understand a complex technique.
We just finished going over a case of a left liver resection and use the Toronto Video Atlas to talk about some of the tips and tricks going over that operation.
So we used a couple videos. First, the video that described the segmentectomy itself, and then an additional video that described the windows to the abdomen in detail. We thought the videos were invaluable both to better understand the operation and to better understand the anatomy that helps us navigate the operation.
So keep making more videos. Thanks a bunch.